really good.
Okay, all right.
Alright.
We can start.
So the chapter I had was chapter 12, like the prevention of like an STD. What, like, how would you like to explain like an STD?
An STD, I would explain it as it's a sexually transmitted disease, and the only way you can get an STD is by sexual contact. The other ways that you can possibly get an STD would be if there was any needle, IV drug use, anything like that.
Can you get it from like a blood contact? Or no?
Well, when you look at HIV,
But no, like nothing like an STD type thing.
no.
What would you say like the most common like STD is? Like,
The most common, there's two types of STDs. They're either bacterial or viral. And for bacterial, the most common that we see is chlamydia, which means when we talk about bacterial, they're treatable. So we can use antibiotics to treat those. But they can also do permanent damage to you. So it doesn't mean that some people get very excited when you tell them they have a treatable STD, but yet it can do some permanent damage.
so like if you like you prevent it for just like a short time, or does it eventually just go away altogether?
When you treat them, like after you treat them, we ask that they come back in about 6 to 8 weeks to recheck, make sure it's completely cured up, because it can do them sterile, basically. Viral STDs, when we look at viruses, HPV, the human papilloma virus, is the most prevalent that we see. And in this particular area, we do see a lot of chlamydia, and lots of HPV.
Would you say it's mostly like in teens, or is it like any age?
We do see in teens, we don't do pap smears anymore under the age of 21 because all of our teens would probably have HPV, and which is sad to say.
Yeah.
So what they're saying is with Gardasil and with time that they can basically outgrow it, hopefully, that they can overcome that virus. So from 21 on up, we start doing those pap smears and checking. So definitely with HPV, that would be a very prevalent one in this particular area, and then chlamydia. But we're seeing a little bit more gonorrhea in this area now too. So,
Or like is there after you get it, like it stays with you for like pretty much the rest of your life, like you can't really there's like no way of like ignoring it.
no, with a viral STD, no, there is no way. Like I say, with a virus, once it invades your body, you live with it, you die with it. It's yours for life. So, yeah. And you will have to do the rest of your life with the outbreaks that come, which that would be HPV, herpes, genital warts, which is linked with HPV, and HIV. So those would be your viral STDs.
Okay, and then in class we discussed like the ABC method, which is the abstinence, be faithful, and like the condoms aspect of it. Would you agree with that?
Absolutely. Yeah, I totally do. And when I go in and talk to classrooms, always talk about abstinence being the 100% that will protect you from that STD and that unintended pregnancy. I talk about monogamous relationships. Very few teens know what the word monogamous means. It means with one. And the importance of being with just one person. Multiple partners here, that was very risky behaviors. Condoms, I cannot say the word condoms enough. I say use each and every time with each sexual activity, any type of sexual activity you engage in, which would be actual intercourse, oral sex, anal sex, if there's any type of genital rubbing, anything like that. I always tell the students, as long as you're always putting a barrier between yourself and the other person to protect yourself.
Alright, so you say the best one would be abstinence. Is what you go with the
Yeah. Abstinence would be the absolute best, yes, because that is the 100% guarantee that I can give you to today, if you practice that, you will not end up with that STD.
All right. Thank you so
Yeah,
much.
yeah. Thank you.
Thanks.